One way you can describe a general surgeon is as a very knowledgeable medical physician who can also operate and perform surgery when it's in the best interest of the patient. So I believe that general surgery is one of the more important specialties, primarily because of the vast range of disease processes and patient responsibilities we take care of. It's been said that you really can't run a hospital without a general surgeon, because at some point virtually every patient in the hospital could require our services.
As a general surgeon, we provide comprehensive surgical care for a variety of abdominal conditions such as gallbladder, appendix, and colon surgery. We also perform endocrine surgery such as thyroid and parathyroid, as well as breast conditions, both benign and malignant or cancer, as well as any other lumps and bumps on the extremities. We can take care of those too.
Practicing surgery means having a lifelong commitment to learning. Our surgeons are continually reading and discussing and advancing so that we can provide the most state-of-the-art procedures and care for our patients.
Our goal was to build a practice of outstanding surgeons doing quality work and taking care of people and families individually rather than doing cookbook medicine.
As surgeons, we are able to provide interventions producing significant and oftentimes immediate and tangible results. In some cases, potentially life-saving even.
What I really liked about the doctors at the surgery group was that they were really specific, really detailed. And any questions that I had, they answered. And they just made me feel comfortable with the situation and what was going to happen.
I think what separates the surgery group apart from other facilities is the relationship that they build with the patients. As soon as the first appointment is booked before surgery and then following up after surgery, it's very hands-on, and we try and understand the patient's needs, their concerns, and just facilitate a two-way relationship.
At the surgery group, there's a big emphasis on continuing education to help ensure the best patient outcomes.
The level of care that you receive from the surgery group as a patient is surpassed by no one else.
Since joining with the surgery group, I've been very impressed with the care for the patients and the surgical skill of each of the surgeons here. Our obligation is towards the patients, and we have no other responsibilities than that.
I was not just a number on a chart, I was a person. At the age of 36, I was diagnosed with medullary breast cancer and knew that I needed to have some type of immediate treatment. And I was referred to them by a very good friend who was a surgeon in a trauma unit. And he said, "This is the very best place for you to go." And so I took his advice and immediately saw them.
The thing that I love the most is I can actually see a change from my result, and my patients are extremely happy and grateful. I take offense if I've let somebody down and they don't feel like they've just been shown the red carpet and they're just not completely happy.
The most gratifying thing is that we're fixing problems for people, and the results are tangible. I take an extra couple minutes to get to know people on a personal level, and not only is it important for me to have a successful surgery and a good outcome, but when somebody comes back to me, it's very gratifying to hear people say, "Thank you, you fixed my hernia, I'm back to work now." And again, as a surgeon, those results are very tangible.
So we solve problems and we take care of people. And it's a really interesting specialty, both in the variety of disease processes and patients we get to take care of, and also the opportunity to be an expert in very specific areas.
The doctors in the surgery group, they did a great job. Their professionalism was outstanding, and I was able to be back 100% sooner than I thought. And that was great for me and my family to get back to normal life.